All right. Well, thank you all for joining us today for the listening session. It looks like we have a lot of folks who have joined in. So we will go ahead and get started with the listening session content for today. So I will go ahead and hand the microphone over to Eric Jasmine from the California Department of Healthcare Services, who will lead us through the presentation today. Thank you.
Good afternoon, everyone. Thank you for joining today's listening session. My name is Eric Jasmine. I'm an analyst here with the Department of Healthcare Services. I will be presenting today's listening session on updates to the Lanterman-Petris-Short Act under Senate Bill 1238. Next slide. For today's agenda, we will dive into recent updates to the Lanterman-Petris-Short Act made through Senate Bill SB 1238, starting with an overview of the LPS Act and recent legislation, including SB 43 and 1238, and a review of LPS designated facilities. From there, we will walk you all through the revised process to apply for LPS facility designation. Then, we will highlight relevant updates to the LPS Act regulations as outlined in Behavioral Health Information Notice 26009 and how these updates impact facility designation. We will also address some frequently asked questions towards the end of the presentation. Thank you everyone who submitted questions in advance. You may also type your questions into the Q&A box at any time during the session. While today's session will not include a live Q&A period, please know that DHCS is tracking all the questions received through registration and during this listening session. We will share answers via an FAQ at a later date, which will be posted on the DHCS website. Next slide. Just a few housekeeping items before we start. Today's listening session is being recorded, and both the recording and copy of the slides will be uploaded to the DHCS website following the listening session. As mentioned, if you have questions during today's presentation, please use the Q&A feature. If you have a follow-up question, please also type this into the Q&A function. The chat feature is disabled. Closed captioning for today's presentation is available in English. To access English captions, use the Zoom captioning function by clicking Show Captions on the meeting control toolbar. If you have any technical difficulties, please chat either Elizabeth Lai or Kelly Roser in the chat. Next slide. To begin, let's discuss recent legislation that made changes to the LPS Act. Next slide. The LPS Act is a California law enacted in 1967 that governs involuntary detention, treatment, and conservatorship of people with behavioral health conditions. Under the LPS Act, a person may be involuntarily detained if they, as a result of a mental health disorder or substance use disorder, have been deemed by an authorized professional to be a danger to themselves or others, or if they are gravely disabled. We will cover the specific criteria on the following slide. And since the LPS Act is part of California Code, it may be amended by subsequent legislation. We will discuss the recent updates in more detail throughout the rest of this presentation. Next slide. The specific criteria under which an individual can be held under the LPS Act if they are considered a danger to themselves or others, or if they are gravely disabled. When the LPS Act was first signed into law, involuntary detention, treatment, and conservatorship were limited to individuals with a mental health condition. But with the passage of SB 43, this legislation expanded the definition of gravely disabled to include individuals with severe substance use disorder, as well as those who have a co-occurring mental health and severe substance use disorder. We also want to note There is no statutory or regulatory descriptions of what constitutes danger to others or self for the purposes of Welfare and Institutions Code 5150. These definitions apply only to Welfare and Institutions Code Section 5260, which is a 14-day hold, and Welfare and Institutions Code Section 5300, which is a 180-day hold. We will cover SB 43 on the following slide. Next slide. As we just reviewed in 2023, SB 43 amended the definition of gravely disabled to include individuals with severe substance use disorder, as well as those who have a co-occurring mental health disorder and severe substance use disorder. This change in definition of gravely disabled aligns how the state approaches behavioral health services delivery, which is not solely focused on mental health services. But SB 43 did not make any changes to the existing type of facilities that were allowed to provide treatment under the LPS Act. This left a gap in California's capacity to treat the newly eligible population of individuals gravely disabled due to a severe substance use disorder only. To address this, California passed SB 1238, which we will cover next and throughout the rest of today's listening session. Next slide. There are a few key parts to SB 1238, but today we will focus on how SB 1238 changed a few requirements to expand the range of facility types that can provide treatment under the LPS Act. Prior to SB 1238, psychiatric health facilities, or PUFs, and MHRCs, mental health rehabilitation centers, could only be licensed to serve individuals with mental health disorders or co-occurring mental health and substance use disorders. In other words, they could not treat individuals with a substance use disorder only. 1238 adds PUFs and MHRCs to the list of facilities that may be designated to admit people with severe substance use disorder only. Counties may now submit applications to DHCS to designate these facilities if they meet certain requirements. We will review the application process and updated requirements in more detail throughout the rest of this presentation. Next slide. As mentioned, there are several key parts to SB 1238. It requires DHCS to issue guidance regarding Medi-Cal reimbursement for covered services provided to a Medi-Cal member receiving involuntary treatment for a severe substance use disorder only, which was covered in Behavioral Health Information Notice 26005 and a previous listening session in March. It also requires DHCS to update licensing requirements and related regulations for PUFs and MHRCs opting to admit those with a severe substance use disorder for involuntary treatment. These updates can be found in Behavioral Health Information Notice 26009 and the associated LPS facility designation interim regulations and is the focus of today's presentation. Before diving in, it's also important to note that SB 43 and SB 1238 are part of a broader set of reforms to the LPS Act. These LPS legislative updates include SB 929 of 2022, AB 118 of 2023, SB 1184 of 2023 to 2024, and AB 2376 of 2024. For more information on the LPS Act reforms, please refer to the DHCS website and the links shared in the chat. Next slide. So, what is a LPS designated facility? They are licensed, certified, or accredited facilities that are designated by the county they operate in and approved by DHCS to provide one or more of the following treatment types, including evaluation and treatment, intensive treatment, additional intensive treatment, and post-certification treatment. Next slide. There are various types of facilities that can be designated to provide treatment under the LPS Act, and most remain unchanged by SB 1238. But notably, psychiatric residential treatment facilities, or PRTFs, are the new type of facility added to the list. Like mentioned before, PUFs and MHRCs are not considered new facilities when it comes to mental health treatment designations under the LPS Act. However, they may now opt to admit individuals diagnosed with severe substance use disorder for involuntary treatment. Next slide. The recent guidance that updates licensing requirements and related regulations for LPS facility designation can be found in Behavioral Health Information Notice 26009. Key updates include adding PUFs and MHRCs to provide services to those with severe substance use disorder only. It also specifies a few revised requirements to crisis stabilization units. And it updates LPS facility staffing requirements and specifies new deadlines for counties to submit the facility designation application. We will cover the application process and review of these regulatory changes next. Next slide. We will start with the county's role in the application process. Counties evaluate facilities and determine whether to support application for facility designation. They then work with facilities to complete and submit applications for DHCS approval. When facilities are approved, counties provide oversight of facilities and monitor compliance with the requirements. Counties may also terminate a facility designation upon termination or revocation of the facility's license, certification, or accreditation as authorized by Section 19 of the LPS interim regulations. Finally, counties are required to regularly report LPS data to DHCS. Next slide. DHCS is ultimately responsible for approving or ending facility designation. This includes routinely inspecting facility sites and records to ensure compliance, as well as collecting and reporting on LPS data. Part of this process may include imposing corrective action plans on counties for non-compliance with the requirements. Finally, DHCS may revoke its approval of a facility designation for host county non-compliance with the LPS Act or the LPS interim regulations as authorized by Section 23. Next slide. As just mentioned, it is the county that submits the application to DHCS to obtain or renew designation. All new facilities seeking designation must work with their host county to use the new application as of February of this year. Existing designated facilities must reapply for designation and meet the new regulatory requirements as of September 1st of 2027. Next slide. For existing facilities, they must be in compliance with the requirements in Article 3 of the interim regulations by the reapplication date, which is again September 1st, 2027. DHCS encourages counties to apply early for existing designated facilities that currently meet the requirements in Article 3. We will cover Article 3 in the upcoming slides. Next slide. Once an application is received, DHCS will notify the Behavioral Health Director in writing whether the application is complete and accepted for review or incomplete within 30 days. If the application is complete, DHCS will confirm the decision to approve or deny the application within 60 calendar days of accepting the complete application for review. A denial notice will include the reasons for denial. Next slide. For incomplete applications, DHCS will notify the Behavioral Health Director in writing of the information required to complete the application. The Behavioral Health Director will need to provide the missing information within 30 calendar days of the date of the notice, or else the application will be considered withdrawn and the county will need to reapply. Next slide. For denied applications, counties may request a review by sending a written request for review by certified mail to Licensing and Certification Division or via email to lpsinfo@dhcs.ca.gov no later than 30 calendar days after the date of the notice denying approval. The HCS will notify the Behavioral Health Director in writing within 60 days of receiving the review request, stating whether the denial is upheld or reversed. The outcome of this decision will be final. Next slide. Once approved, the designation lasts for 3 years, after which facilities will need to renew their application. The expiration date is 3 years from the date DHCS last approved the designation. These applications must come from the county's behavioral health director. Complete renewal applications must be sent to lpsinfo@dhcs.ca.gov at least 90 calendar days before a facility designation approval expiration date. Next slide. Now we will dig deeper into the actual content of the application. The application includes general information related to the facility, such as facility name and mailing address, as well as specific operational questions, such as population served and levels of treatment provided. On this slide, you can see part of the application form related to operational information that needs to be provided by the facilities. Next slide. Additionally, there are 5 supporting documents that need to be submitted with the application. These include a program statement. The program statement includes information related to staff roles and qualifications, staffing structure and ratios, and patient populations. Facilities will also need to submit a fire clearance from local authority, facility licenses, certifications, or accreditations, facility floor plans showing designated areas and bed types if applicable, and a description of how the behavioral health director will provide oversight and ensure compliance with Article 3 standards. Next slide. Next, we will review some of the main changes to the regulations governing the LPS Act through Behavioral Health Information Notice 26009. Next slide. When you open the LPS Act interim regulations, you will find 5 sections or articles, including general provisions, which include updated definitions, the facility designation approval process, which we just covered, new standards related to facility designation, which include staffing standards and we will review next, and 2 sections related to county and DHCS oversight and enforcement requirements. Next slide. Article 3 contains revised standards that designated facilities must meet, including standards related to the way various services must be provided, and how facility changes or incidents must be reported to the host county and DHCS. Each of these warrants a close read of the regulations to ensure compliance. We will highlight a review of the staffing standards in the next slide. Next slide. Article 3, Section 12 of the interim regulations contain the complete updated staffing standards. 2 staff who must be employed on a full-time basis are a person in charge of the facility who's either a behavioral health physician or licensed behavioral health professional, and a nursing head of service who is a registered nurse with at least 1 year of experience supervising psychiatric nursing within the last 6 years. The facility must also employ or contract with enough staff to meet the applicable staff-to-patient ratio, including behavioral health physicians, behavioral health professionals, licensed nursing staff, and other behavioral health personnel. Next slide. The number of full-time equivalent staff required to be working at a given time is directly related to the patient census ratio in a given 24-hour period. This slide shows a table that crosswalks the number of full-time equivalent staff required for a given patient census by role. For example, if there are 21 patients counted in the patient census for a 24-hour period, There must be at least two behavioral health physicians, three behavioral health professionals, six licensed nursing staff, and eight other behavioral health personnel present and on duty at the facility. Full-time equivalent is calculated by adding up the total number of hours worked by staff in the same category in 7 days and dividing that number by 40 hours. There are a specific number of specific and scenario-dependent requirements related to meeting the minimum full-time equivalent staff. While we will not review these in depth today, we encourage stakeholders to closely review Section 12 of the LPS interim regulations. Next slide. A Crisis Stabilization Unit, or CSU, is a provider site that is certified by DHCS or a mental health plan to provide Medi-Cal specialty mental health crisis stabilization services. CSUs are required to be either locked or staff secured with delayed egress, and they must maintain a certification from DHCS of a county mental health plan to participate in Medi-Cal. Next slide. Lastly, we will highlight one of several reporting requirements found in the interim regulations before moving on to frequently asked questions. An unusual occurrence is any incident that may affect the health, safety, or well-being of patients, staff, or visitors, like injuries, deaths, abuses, crimes, or service disruptions. A designated facility must submit a written unusual occurrence report to the host county's behavioral health director within 7 calendar days of the incident, in addition to notifying the county behavioral health director and local law enforcement within 24 hours after the incident. The report must include a number of key information, including date, time, and location of the incident, a detailed description of the incident and staff response, and the plan to investigate and prevent future occurrences. Next slide. The facility must fully cooperate with an investigation by the host county, including to provide all requested records and information and to comply with a corrective or enforcement actions. Facilities must keep unusual occurrence reports for at least 1 year from the date of the incident. Next slide. We will now move on to the FAQ portion of today's listening session. As mentioned at the beginning of the presentation, today's session will not include a live Q&A period. Please feel free to submit questions by clicking on the Q&A button on your screen and entering your questions into the chat. We also appreciate those of you who submitted questions through registration for today's listening session. Please know that DHCS is tracking all the questions received through registration and during this listening session. We will post answers in an FAQ which will be posted on the DHCS website. Next slide. The first question is, do all facilities need to be designated as an LPS facility? The answer here is no. LPS designation of facilities is optional. The host county is not required to designate a facility or obtain the department's approval of a facility designation to provide assessment, evaluation, and crisis intervention in accordance with Subdivision A of Section 5150 of the Welfare and Institutions Code. However, LPS designation is required to provide one or more of the following types of treatment to a patient: evaluation and treatment in accordance with Article 1, commencing with Section 5150, intensive treatment in accordance with Article 4, commencing with Section 5250, additional intensive treatment in accordance with Article 4.5, commencing with Section 5260, additional intensive treatment in accordance with Article 4.7, commencing with Section 5270.10, and/or post-certification treatment in accordance with Article 6, commencing with Section 5300. Next slide. The next question is, what types of facilities may be designated? There are several different types of facilities eligible for designation, including health facilities licensed by the California Department of Public Health, facilities licensed by DHCS, including psychiatric health facilities, mental health rehabilitation centers, and psychiatric residential treatment facilities. Other eligible facilities types include crisis stabilization units, veteran affairs hospitals, and jail LPS units. In addition, counties may designate other types of facilities licensed by DHCS or CDPH that are permitted under the terms of the license to provide treatment or patients diagnosed with a mental health disorder, severe substance use disorder, or co-occurring mental health disorder and severe substance use disorder. Next slide. The next question is about facilities and existing LPS designation. Is a facility that was already LPS designated and approved before publication of the new LPS interim regulations required to comply with the regulations? The response to this question is lengthy, so we will split the answer across two slides. The answer here is yes. Existing designated facilities must be in compliance with the new LPS designated facility interim regulations by September 1st, 2027. Counties must reapply for designation approval no later than September 1st, 2027 for facilities that were designated and approved prior to the publication of the interim regulations. Existing designated facilities must be in compliance with the requirements in Article 3 of the Interim Facility Designation Interim Regulations by the reapplication date. Host counties shall reapply to ensure the facility remains approved in accordance with Welfare and Institutions Code Section 5404 and the regulatory guidance DHCS issued on February 24th, 2026 in Behavioral Health Information Notice 26009. The response to this question will continue on the next slide. Next slide. Additionally, DHCS encourages counties to apply early for existing designated facilities that currently meet the requirements in Article 3 of the interim regulations. Counties may contact DHCS to coordinate the submission of applications to meet the deadline. Next slide. The next question is, how long does it take DHCS to approve the LPS designation for a facility? DHCS will notify the host county's behavioral health director within 30 calendar days of receiving an application as outlined under Section 4 of the LPS interim regulations. As part of this notification, DHCS will let the host county know whether the application is complete and accepted for review or is incomplete. Next slide. The next question is, if a county applies for designation approval for a new facility, can that facility comply with previous designation approval requirements until September 1st, 2027? The answer is no. The LPS interim regulations were effective on February 24th, 2026 and applies to all new applications for facilities designation approval. The new facility must be in compliance with the interim regulations to be eligible for designation approval. Next slide. The next question is, if a licensed facility loses its license, is that facility automatically no longer LPS designated? The answer here is yes. DHCS approval of a facility's LPS designation will automatically terminate on the effective date of termination or at the revocation of a facility's license, certification, or accreditation, or the host county's termination of designation. Next slide. The next question is, how often are facilities expected to renew LPS designation? DHCS approval expires and is subject to renewal every 3 years. The expiration date is 3 years after the date on which DHCS last approved a facility designation. Next slide. The next question is, how should facility report changes to an existing designated facility? Facilities must notify the county behavioral health director within 10 calendar days of any change, including but not limited to facility name, location, mailing address, or person in charge of the facility. The notice must include specific documentation, which can be found in Section 10 of the LPS interim regulations. For changes to designated bed capacity, the county's behavioral health director must submit a written request for approval to DHCS at least 5 calendar days before the date on which a facility's designated bed capacity is scheduled to change. Section 9 of the LPS interim regulations covers more detail here. We also want to remind stakeholders that while these are the requirements for new LPS facility designation as of February 2026, existing facilities are not required to renew certification or meet requirements of the interim regulations until September 1st, 2027. Next slide. Our last question for today is, what resources will DHCS provide to help counties and facilities implement the LPS interim regulations? DHCS is required to support designated facilities in transitioning to updated regulatory requirements and is committed to providing technical assistance through FAQs, webinars, and training. DHCS will also engage with county behavioral health agencies and providers to clarify timelines, requirements, and best practices. Next slide. For questions submitted in today's listening session, we will take these questions back for further review and consideration for a future FAQ. In addition, materials including today's recording and slides will be posted on DHCS's website in the coming weeks. Please look out for more resources to be posted on DHCS's LPS Designated Facilities webpage. If you have any further questions regarding today's presentation, including the SB 1238 Interim Regulations Behavioral Health Information Notice or the LPS Designated Facility Application process, please email lpsinfo@dhcs.ca.gov. Thank you so much for attending.